Good morning, everyone, and thank you for attending this annual training for supervisors. This is the first time we're doing this, breaking out our mandatory annual training into two different types of groups. My name is Patrick Engelhart. I'm a certified safety professional, and I work at the County Employers Group at the North Dakota Association of Counties. I am the safety manager. You've probably either heard my voice or seen me or Mike do annual mandatory training every year since you've been a county employee. Now, this one will take care of your requirement for that annual mandatory training, but this one's going to be kind of geared more for the supervisors to try and help you out and understand why we're doing this training, why we need to do this training, and then what your role as a supervisor or a leader in your organization's org chart, what your role is with that. So we're going to cover that designated medical provider, the DMP program. We're going to talk about drug-free workplace policies, and really most of our time's going to be spent with the injury and accident response and investigation. What happens if you or one of your coworkers, one of your employees get hurt? What do we have to do to make sure that this workers' compensation process and everything to do with that goes as smoothly as possible? So we're going to jump right in and start today by talking about our course objectives. So at the end of this course, you're going to be able to know what a designated medical provider program is, how to figure out who your DMPs are or how to obtain that information, understand a little bit more in detail the opt-out process for that DMP program, and then how to help your subordinates or your other employees in adhering to those DMP policies. We'll talk about why all that is important. Then we'll move into our drug-free workplace program, specifically into your employer's drug-free workplace policy. Now, obviously, we have 53 different counties. We have 3 different law enforcement centers. We have multiple human service zones. Each of them may have their own drug-free workplace policy, so I'm going to hit the highlights of what all of them should have. But I want to make sure that you understand that you should always refer to your specific employer's drug-free workplace policy for any specific guidance that you need. With that too, we'll talk about, again, those general terms for your responsibility as a supervisor under your employer's drug-free workplace policy. And then we're going to move into kind of the meat of this, try and walk you through what happens when somebody gets hurt at work. How do you respond, document, and report those workplace injuries and accidents? We're going to go through filing an incident report with WSI, how to file a first report of injury or a actual claim with WSI, and then how to submit that accident investigation to us here at the County Employers Group, so we can make sure that process goes as smoothly as possible. So starting off today with that designated medical provider. So a DMP, or a designated medical provider, is any clinic, hospital, or doctor that has been selected by your employer to treat work-related injuries and illnesses. Your employer, because they are enrolled in this DMP program, they get to choose where you go for a work-related injury or illness. You have to seek treatment from the employer's DMP. That there's no option to it. You have to do it. They get to choose who you go to. Each one of your employers, whether that's a certain county or human service zone or what have you, has at least one DMP, but they may have more. So if you get hurt on the job, you have to seek treatment at a DMP. Now, the way you get around this, because this is America and everybody has freedom to go to their own provider, is by choosing to opt out of the employer's DMP. You can opt out of that DMP process by selecting and adding your own designated medical provider. And we're going to kind of walk through the specifics of this here on this next slide. Just want to remind anyone, you can opt out at any time throughout the year. Most counties redo their DMP selection forms about this time each year. This isn't the only time that you could change your DMP, however, or any of your other co-workers or subordinates. They could change it at any time throughout the year. The thing we have to keep in mind, however, is that only the DMPs designated at the time of the work-related injury or illness are eligible to count as a DMP. You can't get hurt and then add a DMP and then seek treatment to someone, to a different facility. It doesn't work like that. So let's kind of talk through. I have the next form here. It might be a little bit easier for folks to understand by looking at the designated medical provider selection form. Again, this is the same time of year where you should all be seeing these and at least initialing and dating on the bottom that you aren't making any changes. But if you're new to county government, or if your county or employer has made recent changes to their DMPs, you might have to redo this as well, from the beginning. Your county or zone or whoever your employer is, in that very top section that you see, is going to list all of their DMPs. Again, there's at least one, there may be multiple DMPs listed. That's going to be in that very top section there. You can always seek treatment at one of those DMPs. If you choose not to opt out, you have to seek initial treatment from those DMPs. As we count sections down, the top one and then the second, the third one is where people opt out at. To opt out, you simply put the provider name, address, city, state, and zip, and now you have opted out. You could choose any type of medical provider that you want, as long as they are a licensed healthcare practitioner. We'll put it like that. Most people add, say, a chiropractor to this. A lot of our counties and employers, as part of the CEG, don't select chiropractors for their DMPs. So if you have a chiropractor that you're working with, and that you trust for treating a work-related injury, you can simply add them to that list. So we see that quite often. Again, only those DMPs in effect at the time of the injury are valid. And the reason why this is important, your employer is enrolled in the designated medical provider program at Workforce Safety and Insurance. So if you choose not to go to a DMP, either one selected by your employer or one that you have opted out and added to your sheet here prior to the time of injury, what WSI is going to do is they're going to deny payment of that claim. When they deny payment of that claim for not seeking treatment at the DMP, you are kind of left holding the bag. Your employer has the insurance has denied the claim, so now you have that financial responsibility to the provider that you chose to go to. If you have health insurance through your employer or other health insurance, when you submit it to them, say Blue Cross Blue Shield or Sanford, they're also going to deny the claim because it's a work-related injury and should be covered under workers' compensation insurance. And so you're going to be stuck with the bill. And so this is something as supervisors that we have to remind our employees that when they get hurt on the job or made ill on the job, when they seek treatment, they need to seek treatment at a designated medical provider. Otherwise, we're setting them up for failure, and we're setting them up for a little bit of financial hardship with that initial visit, at least, where they're having to pay out of pocket for that medical coverage. And we can avoid that by simply seeking treatment at either the DMPs designated by your employer or one that you have opted out and added to your list. Now, there are exemptions to this. Emergency treatment is always exempt from this. For example, your county has a clinic as their designated medical provider, but that clinic closes at 5 or 5:30 every night. The employee is injured at 6 o'clock. Where do you go? Well, you go to the nearest emergency room. Emergency treatment is always exempt. An employee is traveling outside of the county and they're involved in a car accident and they need medical treatment, either taken by ambulance or they're going to transport themselves. Wherever they end up is going to be covered by that emergency treatment. We're not expecting people to drive halfway across the state to get to their DMP when they need medical treatment now. So there is quite a bit of wiggle room with that as well. Also, sometimes we run into specific types of injuries that require a specialist right away. Um, so if your county designated medical providers are, say, normally a hospital or a clinic, but you have a dental problem, you broke a tooth and you need to see a dentist, there's no point in going to the ER. You could go ahead and find a dentist, and of course, that emergency treatment would be covered. Or say you have metal shavings in your eye and there's no ophthalmologist on the DMP list, you go to an eye doctor and they take the metal shavings out of your eye, you're going to also be covered as well. So it's not as draconian as it sounds, but for the normal types of work-related injuries, bumps, slips, trips, falls, strains, sprains, things like that, we want to make sure we are seeking that that treatment from those DMPs, again, to avoid that financial liability on you or the injured worker. So that's kind of DMP in a nutshell. We normally cover that a lot longer during our normal presentations. Hopefully you guys all understand that and how important that is and how to fill out that form. Make sure you get those in. We're going to move quickly here into drug-free workplace policies. So each one of your employers has a written drug-free workplace policy. You as a supervisor, it's incumbent upon you to get a hold of that and actually know your role and responsibility in that policy. If you are a supervisor, you're in charge of other folks, you need to know what your role is. So make sure you have that copy of that. Get a hold of your HR or whoever in your county. If you don't have HR to get that policy, make sure you have it, read it, and understand it. In general, all supervisors are going to be required to do about 5 different things. The first of that is to pay attention to warning signs of drug and or alcohol abuse. It's kind of your job as a supervisor to make sure that people aren't impaired on the job because of that higher safety risk that they bring to the job. Excuse me. You will also be required to enforce the employer's policy against substance abuse. With that too, normal kind of supervisory kind of duties require consistent work and standards of all employees. Not saying that you wouldn't, you're all very professional people, but making sure that we have the same standards for all employees. We don't play favorites. And going with that too, we don't cover up or accept excuses from employees for coming to work not fit to work or under the influence or impaired by some sort of substance. And then finally, your last responsibility as a supervisor is to take steps to help your employees. So we're going to kind of talk about all this all the way through. So going with enforcing the employer's policy against substance abuse and paying attention to the warning signs of drug and or alcohol abuse, all supervisors should be trained in reasonable suspicion. So all supervisors should have reasonable suspicion training with periodic refresher training. I am offering next month, November 8th, a reasonable suspicion training for supervisors. Just happened to land like that. That's my normal monthly webinar that I'm giving. The link is listed there. You can also go to ndaco.org, select the ILG tab, and then register under the reasonable suspicion training. If you've never had that before, or it's time for a refresher for you, that's one way to get it. If you have any interest in that at this time. One thing I want to point out, Department of Transportation supervisor. So if you supervise DOT employees, the federal laws covering DOT drivers are very specific on the types of training that you need. You need to have 120 minutes of reasonable suspicion training at least every 2 years to be in compliance with that those 49 CFR requirements for supervising DOT drivers. That 120 minutes is made up of 60 minutes of alcohol training and then 60 minutes of other controlled substances. So the webinar I had mentioned just before this not 120 minutes. It does not meet that standard. But just wanted to let those types of supervisors know that that's kind of the center that they have to work to and train to with that. So as I was saying, as a supervisor, you should have reasonable suspicion training. This reasonable suspicion training is going to teach you how to identify short-term and long-term effects of alcohol and or drug abuse and misuse. It's going to teach you how to identify those signs and symptoms of that, so you can have a reasonable suspicion. So you know how to format that reasonable suspicion to require reasonable suspicion drug testing or alcohol testing of that person. It's going to go through and teach you how to observe and document those employee signs and behaviors that are consistent with drug and alcohol abuse. Some of the other responsibilities that you need to know, again, 53 different counties spread out across the whole state. It's incumbent upon you as a supervisor to know who and how to contact the testing provider. Who is your county contracted with to provide that alcohol or drug testing? And how do you get a hold of them? How does that process work in your county? That should be located in your written drug-free workplace policy. If it's not, those are good questions to ask your HR person or somebody up the higher the chain, so you know and you're not left holding the bag as a supervisor. Again, another one of your requirements as a supervisor would then be, once you have established a reasonable suspicion that somebody might be impaired or under the influence of drugs or alcohol while on the job, you will then instruct an employee to take that reasonable suspicion drug or alcohol test. And then we also have to be familiar with your employer's policies regarding refusals. What do you do if you say, hey, Joe, I have a reasonable suspicion you're at work and you're under the influence of drugs or alcohol. I need you to go. I'm going to take you to this testing site. And they say no. What do you do then? What does your written policy say that you do at that point? Again, most of them are going to say that the employee is immediately terminated. But then again, every county's policy might be a little bit different. So make sure that you know exactly what your policy states. And then with that too, you need to be able to take action depending upon the outcome of that testing in accordance with your written policy. If your policy says that they are suspended without pay, or they are immediately terminated, or they are whatever it says, make sure that you follow through and take action on that once you receive the results of that drug testing. So reasonable suspicion testing is a requirement of the drug-free workplace policy. So again, your employer is enrolled in that program with workforce safety and insurance. And so every county, every human service zone, everybody in the county employer group will have a reasonable suspicion drug and alcohol testing policy set up in your drug-free workplace policy. So this is something to expect that you have. The other thing that you are required to have is post-incident, post-accident testing as well. In order to be in this program. So as a supervisor, you have to know when you should require your subordinates or yourself even to take a post-accident, post-injury drug test or alcohol test. So general guidelines, again, refer to your specific written policy, but generally it's going to include that if a accident involving a motor vehicle or heavy equipment occurs, whether or not an injury occurs, the employee operating that motor vehicle or heavy equipment should be required to submit to drug or alcohol testing. It's reasonable to assume that an accident could have been contributed to by impairment or distraction or something like that caused by being under the influence of one of those substances. If it doesn't involve a motor vehicle or heavy equipment, we have to ask that same basic question. Is it reasonable to assume that impairment contributed to the accident? If the answer is yes, then that employee should be required to submit to drug or alcohol testing. If that answer is no, then no, they should not. So an example of one where they should not, I think I used this last year as well in some of my training sessions. We had an employee sitting at his desk, working at his workstation, and a piece of the molding and or the plaster in the courthouse let loose from the ceiling and smacked him while he was just sitting there working. Now that's an obvious example of when we don't do post-accident injury or drug and alcohol testing. It wouldn't have mattered. He could have been high as a kite. It doesn't matter. It had no bearing whatsoever on the accident. But if we run into those situations where impairment could contribute to the accident, that's when we need to enforce that policy. Again, we need to know who and how to contact the testing provider and arrange that drug and alcohol testing. And then again, take action dependent upon the outcome of that testing in accordance with your written policy. One thing I want to remind supervisors, whether it's reasonable suspicion drug and alcohol testing or it's post-accident, post-injury testing, our employees that we're sending off for this type of testing should never be sent off by themselves. They shouldn't be driving themselves, especially under reasonable suspicion testing. We have a reasonable suspicion that they are impaired. We are not wanting them to drive themselves and put themselves and members of the traveling public at risk. So this is one of those times where you might have to move your schedule around and escort this employee for this drug and alcohol testing. A lot of times with the post-accident, post-injury, this testing can happen right at your designated medical provider. So that can make things a lot easier and smoother. Oftentimes with the reasonable suspicion testing, you're going to have to either arrange a drug tester to come to you, or you're going to have to go to them. It's at those times you're going to have to arrange an escort for them to get them there. Again, our overwhelming goal here is to keep that employee, all of our other employees, and the traveling public or the public in general safe from a potential higher risk hazard. So going back to this original slide here for, if I can find it, for a drug-free workplace policy, taking steps to help your employees. One of the ways that we can help our employees was by referring them to our employee assistance programs. Every county has an EAP that is set up. The vast majority of counties contract with the village, but you can see in the picture on the right, St. Alexis Medical Center, Lake Region Human Service Center, et cetera, et cetera. All of them have different EAP providers. Making referrals to those EAP providers for employees that we see or might have an idea that they might need help with something is that step that we need to take as supervisors to make sure that we're taking care of them and are helping them. We've hired these folks for a reason. They are qualified, they are good people. We want to make sure that they're getting the help that they need so that they can thrive and do their jobs that they've been hired to do. So again, each county, each employer has an EAP program. As a supervisor, you must be prepared to refer an employee to the EAP provider for help. Now, this just doesn't include drug and alcohol problems. If you feel maybe they might have some other things going on, some mental health issues, other mental health issues going on, or financial issues or something like that, the employee assistance program that's what it's there for. And we should be prepared to refer them to that. It's incumbent upon you as a supervisor to know how to contact that EAP provider, not only so we can refer the employee to the EAP, it's also a great resource for you as the supervisor. So if you run into questions about, God, I can't really tell this employee might need help, and you call the village, they have people there that could talk you through that whole process, maybe give you pointers on how to approach that person to get them referred to EAP as well. So using that EAP program, being prepared to refer it, knowing how to contact them, Again, a very important part of your job as a supervisor. It's already paid for, at least for the referral service from all the counties. It's there, and it can only help. It can't hurt. Finally, moving on to the meaty portion of today's training, is our injury incident reporting portion. We're going to spend quite a bit of time here today because supervisors have an elevated level of responsibility in handling this. So the first things we're going to talk about today is what's the difference between an incident and an injury. An incident is any time an employee is hurt or made ill on the job but is not seeking medical attention. Generally speaking, those are our first aid type injuries, nuisance type injuries. You bumped the knee or smacked a hand or a paper cut or something like that, and no, they don't want to go to the doctor for it. An injury is any time they seek medical attention. So if they're going to go to the chiropractor, they're going to go to the eye doctor, they're going to go to the clinic, it is always an injury. And the reason why this is important is deciding on how we're going to report that. In either case, whether it's an incident or an injury, we have roughly 24 hours to report that. By reporting that, that means we have to either submit to Workforce Safety and Insurance an incident report or a first report of injury. So how do we submit an incident report? In your county or in your zone, you may have risk managers that do all of this for you. I'm going to go into a little bit more detail today in case that risk manager becomes unavailable or this is part of your normal workflow or for whatever reason, so you know how this system works. So an incident, again, we have an employee that's injured or made ill on the job, but they are not seeking medical attention. In order to file an incident report, we simply go to workforcesafety.com, or we can put into our Google machine, North Dakota WSI, and then when we follow that link, you're going to end up on this page, workforcesafety.com. When we go to the Quick Links tab on the right, we'll follow that drop-down menu to file an incident report. Again, this is an employee who has been hurt on the job but is not seeking medical attention. Once we smash that file an incident report button, this screen is going to come up, the incident report. So again, we have 24 hours to get this in. What this incident report does is it buys your employer more time in case a claim gets filed later. Sometimes we see that happen where someone says, oh, it's just a minor thing, I'm going to give it a day or two. And then it doesn't get better. And then they end up seeking medical treatment. If we haven't filed that incident report, your employer is going to get dinged for late filing because it's always going to go back to the date of claim. And then we have 24 hours from the time of injury to file that claim. So you've hit that quick links, you've gone down to file an incident report. This is the screen that comes up, and it's going to ask for either the company name or the company account number to assign or route that incident report. The employer account number is always the easiest way to do it, and here you have them. So for all county employees other than human service zone employees, it's that 1196351 number. For all human service zone employees, it's the 1508982 number. It doesn't matter what county you work in. It doesn't matter what department you work in. It will be one of these two numbers. So again, human service zone employees are in this account, the 1508982. All other county employees are in the 1196351 account number. I know that's a lot to remember if you're filing an incident report and it's something that you don't do very often. So if you do not do it very often, the other option is to put in the company name. Now with this, your county or human service zone is not in the system. you will have to type in ND Association of Counties, mash the search button, and then at the very bottom, it'll select North Dakota Association of Counties Incorporated. You hit the select button and it will move you to the next screen. Again, if you have access to these numbers or you remember them or memorize them because you're some sort of numbers whiz, that's great. But you can always search for it by name. We just have to remember to search for North ND Association of Counties. Once we've gotten past that hurdle, that roadblock, up comes the incident report. This is a very easy, very simple form to fill out. All you need is first and last name and the date of birth of the injured worker. Of course, the injury date, because you're doing it the day of. Again, we don't want to wait on these. We have 24 hours. After that, you're going to select the injured body part and the location, and then you're going to just simply add that information in there. It's very quick, very easy to file that incident report. Again, this buys your employer 2 weeks. So anytime 2 weeks after that incident report is filed, if that employee now wants to seek medical attention, we're covered and nobody gets hit for late reporting. So again, within 24 hours, as soon as possible, once an incident has been reported to you as a supervisor, you either want to get that information to the risk manager so that they can file the incident report, or you could file the incident report yourself, depending upon how your county or your zone has set up how that process works. Next, now we have injury reporting. We have an employee that has been injured or made ill on the job and they are seeking medical attention. Kind of the same beginning steps. Again, we go to workforcesafety.com or we put North Dakota WSI in our Googler. We follow the links. We end up on workforcesafety.com. Again, we go to the quick links drop down bar and we go, instead of going to file an incident report now we go to report an injury. We are going to file that first report of injury. We are going to file a workers' compensation claim form. This is the splash page that you add into. Requires quite a bit more information, and so you might have to work with your payroll department or with your HR to get some of this information from time to time. Again, every county, every zone has a risk manager. Again, most of the time they're the ones who fill this out, but if you need to fill this out and you need help, you can always contact them as well, or us here in the office at the county employer group as well. First and last name, so we have Joe Snuffy Llama that got hurt. We need access to that social security number and date of birth, and the employee's address, and then date of injury. You'll see all the required fields are marked by the red asterisk. It's going to ask if they have received treatment for the injury. Again, it's always going to be yes, right? Because we're only filling this form out if they are seeking medical treatment. They want to know the day, when they sought treatment, where they went, et cetera, whether or not it was an emergency room visit or not. And then finally, at the bottom, you're going to put the employer details, the employer's name. It's in that spot. Go ahead and put your county or your human service zone in there with the mailing address, phone numbers, et cetera, et cetera. Enter the employee's job description here. Joe Snuffy Llama is a sheriff's deputy. Date hired, the year that they were hired in, last day worked prior to the injury. The last day worked prior to the injury is always going to be a date prior to the injury date. So if they were hurt today at work, but they worked yesterday, you're going to enter 10/30/23 because today is 10/31. It won't let you have last day worked and the same day as the date of injury. I don't know why WSI did it like that, but they did it like that. So now we've reached the very bottom of the first page of the first report of injury. Here's a thing that we need to make sure that we do. The very last question is, who is filling out this form? The employer is filling out this form. You as the supervisor are filling out this form. So you are representing that employer. So we are going to check that box. It's very important that we get this employer information filled out. And so that's going to bring you up to this page. Again, it's going to ask for that employer account number. Again, you have those two different employee account numbers, or excuse me, employer account numbers. All non-human service zone employees, that 1196351 number, or human service zone employees 1508982. That's what goes into that box. If you don't know, your risk manager will know, or you could call us here at the CEG. We could get you the account number. With that too, everybody in their box, in the little options box that you have with the GoToWebinar, there is a chat function, and a questions function. There should also be a handouts box as well. This entire PowerPoint is located in that handouts. You can simply click on that and download that to your computer. And then now I'm seeing I have a question here. When a report is filled, you still need a signature of the risk manager. The signature of the risk manager is handled electronically on this first report of injury, and that's on this page here with the employer. It's one of the last things. It says employer signature. You simply put in your name, your title, date signed, and then it's going to have that signed as well with there. So again, all of this information gets filled. We hit the next button. Actually, I'm going to back up real quick here. There is one of these questions that might seem kind of odd to you. Do you question this claim? It's about the fourth question up from the bottom. Do you question this claim? If yes, explain on the following page. That might strike people as odd, and so we're going to explain that a little bit in detail. Sometimes there are circumstances that happen as employers where you might question the validity of a claim or not. So in this example, I did mark no there, but here's an example of a reason why we might question the validity of a claim. In this example, an employee reported the injury after being terminated. Unfortunately, we do see that from time to time. Anything other about that injury or about how the circumstances surrounding that injury happened should be included in this additional info box. Again, this is only an example. Backing up one more time, the DMP. Do you have a designated medical provider? We always mark yes. The next question, did the employee add another medical provider? That's asking whether or not they opted out. This is another example of when we might need to reach out to the risk manager, because they are the ones who know whether or not an employee opted out. They have and retain those forms. Again, we have another question out there in the employer's name section. Yeah, the employer's name section. All right, let's back up to employer's name. The employer's name is going to be the county that they work for. The employer's name is going to be the county or the human service zone that they work for. Seems like I'm getting a few more questions in. I have the names of the askers here. I'm going to go ahead and reach out to you afterwards to answer your questions so I can get through the rest of this here. All right, so we've talked about the DMP. We've talked about whether or not we question the validity of the claim. And then this is going to be what the last page is. As you see on the top there in the red, you have a form. Your form has not been submitted. So when you get to this is how you review that. When you scroll down to the bottom and everything looks correctly, looks good to you, that's when you're going to submit it. At that point, it's going to give you a receipt with a print function, a function on it where you could keep a copy of it for yourself. So if you are filling this out as a supervisor, this is something that you should print and get back to your risk manager as soon as possible as well. The last little portion we're going to talk about today is accident investigations. A lot of supervisors might not do the first reports of injury. They might not do the incident reports, but a lot of our frontline supervisors are being asked to complete these accident investigations. These are also very important to be completed for every time an employee seeks medical treatment. An accident investigation should be done. That accident investigation should be submitted at the website listed right in front of you here, ceg-amp.ndaco.org. We see in the upper left-hand corner accident investigation form. And so when we mash on that tab, this is what pops up. Again, it's going to ask for very basic information about the employee. All those basic details, the name, what county they work for, that's in a drop-down box, so it'll list your county, the location, et cetera, and then I'll ask 3 questions. How much experience did the employee have performing the task? If they're a new employee or if it's the first time task, that's information that we need to know. Or in this example, Joe had been walking for 45 years before he injured himself by stubbing his toe. What was the task being performed, et cetera, walking down the hall, and then any PPE that they were wearing. Very simple, basic information on the first page. The next page is where we run into problems with these accident investigations. The root cause analysis, we're trying to figure out why the injury happened and what we could do to fix it as an employer. As a supervisor, that's part of your job. Help prevent these accidents from happening. And so to get that root cause analysis, we have to figure out what the proximal root cause of the injury is. And with that, we have that method of injury. So in this example, the employee tripped on a box, injuring his foot. And then we have to ask the 5 whys for root cause analysis. That's why we have the 5 whys lined out there. So when we ask why the employee tripped on the box, injuring his foot, we answer it. Employee did not see the box. Why didn't the employee see the box? Now we're getting into what was going on. Well, the employee was rushing. They were in a hurry down the hallway. They were looking at their phone and the hallway was dark. Well, why was the employee rushing, looking at their phone, and the hallway was dark? Well, we know the employee was rushing because they felt they needed to rush. They were looking at his phone because they were trying to multitask. We don't really have to answer those questions. We can answer, why were the hallway dark? What was that other contributing factor? The lights were burnt out in the hallway. Why were the lights burnt out in the hallway? The maintenance man got fired 3 weeks ago and hasn't been replaced. What's the root cause of this incident? Well, now we can go back to the rushing and looking at his phone. Eyes not on path, mind not on task. Now we can talk about the poor lighting, poor housekeeping by having the box laying in the hallway, and then always lack of supervision, hazards not recognized, right? It's always going to end up in some sort of supervision or management failure, right? The big management failure here is we had lights burn out in a hallway. Nobody changed the light bulbs because nobody planned for the maintenance man to get fired and nobody took over those duties, right? That's how we get through a good root cause analysis. The next page we fill out, it's going to be a list of different hazards, et cetera, et cetera. So for example, the hazards here, we're going to simply check those boxes that meet up with those root causes that we identified on the previous page and give a reason why that happened. Once we've identified those causes, we're going to identify the primary root cause: poor lighting, poor housekeeping, management failure. Again, once we find a management failure, we've found the root cause. And then now we get to set our corrective actions. Our corrective actions, we're going to replace the light bulbs. We're going to remove the boxes from the hallway, and now we're going to assign temporary maintenance duties to Jody. Jody's going to go ahead and take over those duties until we can hire a replacement maintenance person. This is a real simple, easy form as well to fill out. You simply just choose what kind of control it is, add the note. There's add new and remove buttons if you have multiple corrective actions that you need to do. The next page of that accident investigation form is for any attachments. Now, I used a pretty simple example, but sometimes you have things like witness statements. You might have pictures of the injury. You might have pictures of the motor vehicle after the accident. All that type of information that you want to retain and have on file, you can simply attach it here, just like you attach lots of different things online nowadays. Choose the file, hit the attachment button, and then now it's saved in this. The final portion of the accident investigation form, you're signing it when you submit it. Simply put in your name, check the box to sign, and click submit. When you submit that up, you're going to have an accident investigation root cause analysis receipt. It's very important here as a supervisor to get this to your risk manager. In the upper right hand corner is a print button. You can either print off a paper copy or you can print the PDF and save it, email it, fax it, snail mail it, whatever you got to do with it to get it to your risk manager. And that's just going to have that summary readout of everything that you've done with that. I know that's pretty hard, hardcore, fast, down and dirty. We talked today about DMP process, making sure that we're filling out the DMP selection forms. We're making sure that our employees know that they have to seek treatment from those designated medical providers. We've talked about roles and responsibilities with the drug-free workplace program, how important it is for supervisors to have reasonable suspicion training. And then we've talked about that process of reporting injuries and incidents. The key takeaways from reporting those injuries and incidents that I want everybody to remember is that if we have an injury or illness, whether or not they seek medical treatment or not, we have to get it reported within 24 hours. It has to happen. So we want to get that incident report filed, whether you do it or your risk manager does it. We can't, this isn't something you want to wait several days for, okay? No matter how minor, let's get those incident reports filed. If we know of an employee seeking medical treatment, we want to get that first report of injury filed and completed as soon as possible. And then with the accident investigations, that has a larger time frame, but we have to make sure that those get done as well. We have 4 days to complete those accident investigations, 4 working days to complete them from the date of injury. Get those done and get those submitted. A lot of information in a quick period of time. Again, this entire presentation should be in the handouts attached to the webinar here. You can simply download that. My contact information, I'm the bottom one there on the screen for you. That's my number, 328-7314. My email address. You can always reach out and ask questions of me or either one of my coworkers, Mike Wolf, Jennifer Mormon here at NDACO, or you can always contact your risk manager for more information as well. I do have just a few minutes left, so there is one question here that I kind of skipped over. If a department head does the report, do you still need the risk manager to sign it? And would that be the first? Either one, we don't need the risk manager to sign it. If this is being filed, the accident investigation is being filed by a frontline supervisor, that's fine. I just want to know who did it, who did the accident investigation. That just needs to be in there. It wouldn't necessarily have to be the risk manager. It's whoever is completing that report on behalf of the employer. Same thing with the first report of injury. It's whoever's completing that report employer signature. So as a supervisor, you're empowered to represent your employer. That's part of your job. Just make sure your name goes into the employer signature line, and then your title. If you're the highway superintendent or you're the auditor or whomever you are, that's fine to sign that too. It doesn't necessarily have to be the risk manager. The key to remember with all of this stuff, the risk managers in your county and in your zone have special training and have experience with this. So if you ever need help with any of this stuff, uh, with the injury or incident reporting, with the filing of a workers' compensation claim, the first report of injury, or with completing the accident investigation, feel free to reach out to your risk managers or us here at the CEG, and we can walk you through each step. Or I've filed plenty of claims for other counties before. I've walked them through and done accident investigations. Reach out to us for this and we will help you. Okay. With that, I don't see any other questions in. About 10 minutes early, I'm going to go ahead and let everybody take off and end the webinar here. Again, the PowerPoint is attached, so you have access to that, and that has all the contact information for any other questions that you may have. Thank you very much today for spending some time with us. We hope you learned a little something or refreshed something in your memory about this. Hopefully it was helpful to you. And then just a reminder, because you have attended this training, you do not have to attend any other mandatory annual training the rest of the year. This covers you for the designated medical provider and drug-free workplace training. Just make sure that you sign off on your designated medical provider selection form and get that turned in to your risk manager. Thank you very much for your time and attention, and I hope you have a great Halloween and a great rest of your week.